Huashan Hospital affiliated to Fudan University. Dr. Yu Chenggong, head of Nanjing Medical Team Assistance of Hubei. Dr. Niu Haitao, the team leader of Qingdao Medical Team Assistance of Hubei. Dr. Yang Yang from the 3rd Affiliated Hospital of Sun Yat-sen University. Mr. Li Yang, head of the Hubei Provincial CDC. They will be taking your questions in this press conference. First, let's give the floor to Mr. Li to brief you on the latest numbers. As of yesterday, the total number of confirmed cases in Hubei Province amounts to 67800, among which 50,005 are in Wuhan, accounting for 74%, and the rest of the cities accounts for 26% and amount to 17,795 cases. In the last 24 hours, we report 0 new confirmed cases, 0 imported cases. Provincially, the number of confirmed cases reports 0 for the 3rd consecutive days. Cities outside of Wuhan report 0 cases for the 16th consecutive day. As of yesterday, number of people still in hospital for treatment amounts to 5,425, among which 1,521 are severe cases and 406 are critical cases. As of yesterday, the total number of deaths adds up to 3,139. Yesterday, we reported 6 new deaths, among which 6 in Wuhan and 1 in Qingdao. As of yesterday, the total number of discharged patients amount to 58942. Yesterday, the number of newly discharged patients in Wuhan, 561, among which 502 are in Wuhan, accounting for 89% of the provincial total. Now let's give the floor to Dr. Liu to brief you on the work of the Tongji Hospital in assistance of Wuhan and Hubei. I will brief you on the treatment of the critical and severe cases. The Tongji Hospital is one of the designated hospitals to treat critical cases, and we start our renovation of the wards from February the 2nd. We have 1 ICU and provides more than 800 hospital beds, and began to take patients from February the 9th. We have medical teams from 6 provinces and 17 national teams, and a total of 2,300 medical workers work alongside our colleagues. Our hospital has been working hard to improve recovery rate and reduce fatality rate, move the treatment timeline forward, and as of 7 o'clock this morning, we have altogether received more than 1,400 patients, among which more than 80% are critical and severe cases, and a total of more than 800 patients have already been discharged, and about 500 of the patients are still in hospital for treatment. We have established a coordinated mechanism to consult on the treatment of critical cases, and we have formed a temporary administration in terms of the management of the treatment to report the statistics and discover relevant problems. And we have unified this administration and procedures in order to realize more efficient treatment. Second, we strive to construct a very stringent system in terms of treatment. And conduct consult of the difficult cases and death cases, and we held meetings for each afternoon and held discussions between experts of different departments, and the panelists of experts also participate in this discussion in order to strengthen our understanding of the disease so as to realize more standardized and more unified treatment process. We have formed this wartime administration, and in order to improve our quality of medical services administration. The QC group also are in charge of the arrangement of shifts as well as the quality check of different departments. 3, we have monitoring closely the situation of the severe cases through the e-medical records, and we also conduct timely checkups and adjustment of their treatment plans, monitor closely the treatment of the critical and severe cases. 4th, to conduct this multidisciplinary treatment, especially to cases with multiple organ problems. Due to the lack of personnel, we make full use of our advantages and have divided our medical staffs into different groups in charge of the different body organs, and also conduct this multidisciplinary treatment on patients. Coming up, we will continue to act according to the important remarks made by General Secretary Xi Jinping and continue to optimize our treatment process and learn from the past lessons in order to improve the recovery rate and reduce fatality rate, and finally be able to win this battle. Now, Dr. Ma will be talking about the situation of Huashan Hospital from affiliated to Fudan University. We have altogether sent 4 medical teams in assistance of Wuhan. Altogether, there are more than 200 staff, and the second group of people actually arrived at Wuhan on February the 9th, and on the 10th they have begun their work in the ICU of Tongji Hospital, among which 34 of them are doctors from the ICU department, respiratory department, and digestive department, as well as surgical department. So we are a big team with many disciplines in order to conduct treatment to the people with multiple organ problems. We also bring with us 180 nurses and 1 respiratory doctor. After arrival, we began this training process to prevent hospital-acquired infections. Training is essential in terms of prevention hospital-acquired infection because it is essential for us to protect ourselves before conducting treatment on patients. During our work, we have divided our personnel into different groups. We have 30 beds and 30 hospitals, so 10 doctors are in charge of 10 beds, and we have very specific division of labor when it comes to our jurisdictions. So at the busiest hours, we have 30 beds, 30 hospitals, and 27 of them are hooked to ventilators, and 2 of them are attached to ECMO, and more are on dialysis machines. And we also have done a surgery on one of the patients. After our efforts, we are becoming more and more familiarized with the work that we're doing, and we are seeing better and better treatment results. I also want to extend my special thanks to the 16 medical teams as well as our hosting hospitals for your support in terms of administration and the expertise that you have provided. Now, Mr. Yu Chenggong will be talking about the Jiangsu medical team. Good afternoon. The Nanjing medical team consists of 132 team members, and we arrived at Wuhan on February the 9th and began our work the second day. We have been following up the principles of targeted and individualist treatment, and we attach importance to humanitarian care, and our work has been proven effective. As of yesterday, altogether we have admitted 86 patients, among which 47 are critical and 47 are severe and 10 are critical cases. We have also conducted CRRT as well as ECMO treatment on one of the patients. As of yesterday, 49 cases were discharged, and we realized 0 deaths and 0 hospital-acquired infection during our work. Right now, we are at a very critical juncture in terms of treatment. We'll continue to act according to General Secretary Xi Jinping's remarks on the treatment and containment of COVID-19. We'll continue to improve the recovery rate and reduce fatality rate and until we have finished our work completely. Mr. Liu, would you like to introduce the situation of Qingdao medical team? The Qingdao medical team consists of 132 medical professionals from respiratory, ICU, digestion, psychological, and other internal medicine department. After arrival, we've been following closely the treatment principles, that is 0 infection, 0 complaints, and humanitarian care, and timely treatment and timely psychological consultation on the patient. And the one strengthening means that the cultural and education in terms of in the process of the treatment. We have also realized this kind of video shift as well as the grid management, as well as other medical measures, including non-invasive and invasive ventilators and this SOP, to address the difficulty of ultrasound pulmonary injection, as well as the other implant through ultrasound. The application of such technologies have substantially increased the efficiency of treatment. We are from different disciplines, so each night we will be holding a multidisciplinary consult to discuss the key cases. Each night, 7 p.m. at our hotels. As of yesterday, we have treated 95 patients, among which 68 were already discharged. There are some typical cases, including one patient of 107 kilograms as well as a senior citizen with 91 years old. This patient has been successfully discharged today. Now we are seeing the dawning of the spring, but we will continue our work until this battle is finally won. Now, Mr. Yang, would you like to introduce the situation of the Sun Yat-sen University affiliated hospital? The third affiliated hospital in assistance of Wuhan sends out more than 130 patients. We have treated 88 patients, and 78 of them are critical or severe cases. And we conducted integrated and targeted treatment as well as cross-disciplinary treatment. We conduct this multidisciplinary treatment on a patient, and the experts of different disciplines will be taking care of the most acute problem of the patient. And we need to prioritize while coordinate. We also conduct individualized treatment and targeted treatment for each patient. And we will discuss and update these treatment plan on a daily basis and provide them with nutrition support and psychological support in order to further improve treatment and recovery rate. And 80% of the death cases are people over 60 years old. So the average age of our patient is 63. So we have to strengthen the comprehensive administration of the patient in order to reduce fatality rate. Now the floor is open to questions. Please identify yourself first. With CMG and CCTV. According to Dr. Liu, when treating the severe cases, we have to pay attention to the multiple organ problems, and you have formed multiple medical teams to deal with this problem. So what is the work content of these different teams? Mr. Liu? Many severe cases are with organ or kidney dysfunctions. Some of them are suffering from diabetes, the cardiovascular diseases, or tumor. And the different medical teams have different disciplines and are from different departments. So it's hard for us to meet the needs of all the patients. And the Tongji hospital make full use of its advantages as a comprehensive hospital. So we have formed different teams to provide technical support and improve treatment level. For example, we have an intubation team, and we have also assigned supporting staff to help the team of intubation to do their work. We have performed intubation on 74 patients. We also have a respiratory department that provides psychological intervention as well as perform ECMO on the patients and artery implantation on the patients and help them to recover. We perform ECMO on 6 patients, and 4 of them are already disconnected from ECMO, and 2 of them are still receiving treatment. We also have kidney experts and nurses to deal with the kidney problems, and they are in charge of performing CRRT and prevent inflammation storm from happening inside a human body. And we have performed this procedure on 259 patients. the other teams are in charge of nutrition, TCM, and other disciplines, respectively, and they are in charge of the technical support of their own disciplines in order to improve the recovery rate. The question goes to Mr. Ma. The Huashan Hospital is in charge of the ICU, and in which the most severe cases were treated. So, what are your experiences that you would like to share? In the ICUs, the patients are all critical and severe cases with the problems of multiple organ failures. So it requires a synergy from different departments. We have 17 medical teams with the best personnel, but we're still understaffed. That will require us to have more support from the Tongji hospital to do the coordination so that we can form a team that can fight, and to form a team that is consists of people from different hospitals, a team that we can discuss and conduct consult of the patient in order to realize targeted treatment in the ICU. Each morning during the shifts transfer, we will find that the experts from different departments, different hospitals are discussing on the treatment plan, which will improve the efficiency of our work. And second is to conduct early treatment. That will require early evaluation and early plan making, because this is an acute disease in which the patient can deteriorate very quickly. So we have to be in time in terms of the making of the treatment plan. So when we need intubation, we need to do it as soon as possible. If we want to connect this person to ECMO, we also need to do that as soon as we can in order to improve our efficiency. With Jiangsu TV, my question goes to Dr. Yu. In conducting treatment, you have to do this integrated and targeted treatment plan. So can you be more specific in terms of the roles that your team has played? So first, we rely on this multidisciplinary model because most of the severe cases are also suffering from pre-existing conditions, high pressure, diabetes, and kidney disease or stomach diseases. So it's of paramount importance for us to realize multidisciplinary treatment and pay attention to the multi-organ functions. So our team are formed of experts from ICU, from respiratory department, from infection department, and anesthesia department, as well as a neuro department. And we also have experts from ICU and ICU nurses. And it's important for us to make individualized plans on these patients in order to achieve good results. In our team, many of them are also cross-disciplinary experts. They can conduct ultrasound, CRT, and ECMO, as well as intubation. We also need to realize our team of experts in terms of the administration. Some of them are working at the clean area, some are working at the contaminated areas, and they need to conduct communications in a timely manner. We also need to conduct communication with our experts from home and the front line. And there are many online consults that were conducted during this process. We also need to work with the local experts and rely on their expertise and experiences. Now we have another team who is now been transferred to the Renmin Hospital, and we also conduct very timely communication with them. 3, we also conduct this full process, this complete process, psychological consult, because most of the severe cases are also experiencing psychological problems. So we conduct this psychological rounds on a daily basis, and we deploy psychological experts to attend to their needs. For the discharged patients, we also help them to recover in a psychological sense. So last but not least, we also attach importance to humanitarian care. We talk to our patients in a frequent manner and share with them some of the experiences so as to lift their spirit up. I'm with Shandong TV. So Dr. Niu, you mentioned the importance of early treatment. So can you tell us more about that? So this is a coronavirus disease, an infection which can hurt multiple organs, and the lung is one of the most vulnerable organs. And during this process, it might trigger liver, heart, and kidney diseases. If this happens, it will cause MODS, that is multiple organ failures, and that will substantially increase the fatality rate. Therefore, the lack of oxygen might be one of the biggest problems that the patient might experience. A lot of these severe cases were with pre-existing conditions upon admission, so it's very easy for them to deteriorate during treatment, and there is no specific drug in terms of treating COVID-19. So what we can do is to do this physical support, and in order for the immune system to continue working and clean up this virus. So time has become a very crucial factor, and we also need to conduct this kind of early and in-time treatment to this plan. For the people who are experiencing breathing difficulties, we have to conduct invasive ventilation, and it also takes time for the lung to repair itself and restore its function. So at one time, we need to provide opportunity for the lung to repair itself, but also we need to support the normal function of the lung by using ventilation. And therefore, sometimes we have to do the incision of airways so as to conduct a better management of the tract. At early stage, some patients also are experiencing the dysfunction of its kidney, which also calls for some specific treatment. And for the patients who are experiencing heart dysfunction, we also need to provide treatments such as ECMO. So all in all, the earlier we discover these functions, the earlier we should conduct treatment in order to reduce the damage on single organs as well as multiple organs. we mentioned that we have a patient of 109 kilograms. So at an early stage of breathing failure, we have conducted intubation on the patients as well as invasive ventilation and blood cleansing, so that he did not develop to multi-organ failures. And within 10 days treatment, he is now disconnected from the ventilator and is on his way to recovery. Dr. Yang, most of the severe cases are people over 60 years old, and you attach great importance to the treatment of senior citizens. Can you tell us more on that? The treatment of old-aged patients are meeting with the following problems. The first is that they are already with organ problems and low immunity. Many of them are with pre-existing medical conditions. So the oxygen deprivation can also lead to the impairment of immune system as well as malnutrition. More than half of the patients will also be experiencing anxiety, fear, and depression, and it might cause a lot of challenges in clinical treatment. So first, we conduct this oxygen treatment as a basis for treatment in other disciplines. We also combine the treatment of COVID-19 with that of other diseases. We also strengthen observation and conduct early intervention in order to prevent it from deterioration. Through scientific management, we follow closely the key indicators as well as the monitoring of the organ functions and conduct multidisciplinary consult in a timely manner. In emergency, we also deal with these problems in a timely manner. We also send experts to conduct rounds each morning, each evening, and during night shifts. We also conduct discussions of different departments, which is essential to treating old-aged patients. We also help them with nutrition support, psychological intervention, and early evaluation, close monitoring, and follow-up is our treatment principles. We also help the patient with their existing problems and provide them with emotional support and also music treatment and necessary drug treatment to help them to maintain a stable mood in order to cooperate with the treatment. We also conduct respiratory exercises and help them to restore their normal respiratory functions and so as to expedite the recovery process. We also strengthen nursing treatment that combines psychological, nutrition, and other physical cares. For these special patients, we also deploy special personnel to help them with rehabilitation, nutrition support, and psychological intervention in order to create a favorable environment for recovery. Through our work, we are aiming at improving the recovery rate and treatment of these old-aged patients. Thank you all for your questions, and my thanks also goes to the speakers.